Back. Is anyone seeking recognition for an opening statement of the Republicans? I'm seeing none. The gentleman from California is recognized for 3 minutes for an opening statement.
Thank you, Mr. Chairman, and I want to thank all the people in the audience here today as well. As we move through this markup today, I implore my colleagues to not lose sight of why we are all here: to represent our districts, to pass legislation to better our nation, to protect and improve the lives of our constituents. And make no mistake, the policies in this big, ugly bill do the exact opposite. If this bill became law, it would devastate the healthcare infrastructure my and all of your constituents rely on. It would strip healthcare coverage from millions of our most vulnerable citizens. And over 42% of my constituents rely on Medicaid or Medi-Cal in California for their health insurance, including over 60% of children. According to the Congressional Budget Office, the policies in this bill would lead to at least 13.7 million people losing their coverage. But this fight isn't about numbers. This is about real people. So let's hear from one of those whose lives are on the line. I would like to share the story of a young constituent of mine, Victoria. Here is Victoria's story in her own words. Quote, "As a resident of the Imperial Valley, a low-income, rural, and underserved region, Medi-Cal or Medicaid is one of the only ways I've been able to access medical services. Medi-Cal is the only thing protecting me from the challenges and consequences that come from needing crucial medical services. As a graduate student, I cannot afford to leave the country or incur a financial burden just to take care of my health. Sadly, I feel lucky to be a young woman because I cannot imagine how much worse potential cuts to healthcare funding could adversely impact our most vulnerable. Healthcare is non-negotiable, and I refuse to risk my or my loved ones' lives over budget savings. I am also not alone in this, as my friends and family and about 90% of Planned Parenthood's patients in California rely on Medi-Cal, our state's version of Medicaid, to afford reproductive health care. I, along with more than 72 million Americans, rely on Medicaid for health care, including essential reproductive health services like birth control, wellness exams, STI tests and treatment, breast and cervical cancer screenings, and more. These services and our health deserve to be a financial priority, so I urge you to defend Medicaid and our well-being." Victoria is not alone, and I urge my colleagues to keep her story and the stories of so many other Americans, including your own constituents, in mind as you consider the legislation before you today. It's simple choice. Strip healthcare coverage from our nation's vulnerable in order to give tax cuts to the wealthy, billionaires like Elon Musk, or protect the constituents you swore an oath to represent, and do not cut Medicaid and take healthcare away. Thank you, and I yield back.
Gentleman, Thomas. Gentleman yields back. Gentleman